An expert in tropical diseases says the crisis in Puerto Rico could get even worse if running water, sewers, and hospitals aren't brought back online fast. Here's Marcelino Benito.
Over the weekend, relief efforts ramped up in Puerto Rico, but the U.S. territory may be on the verge of an even larger health crisis.
Puerto Rico's gone back in time 100 years.
Puerto Rico has no power, and more than half of the population doesn't have access to clean drinking water. The island was already dealing with high levels of poverty. Now it's even worse. It's a toxic mix that has health officials here and on the island very worried.
Diarrheal diseases are almost certainly going to occur.
Dr. Peter Hotez, Dean of the National School of Tropical Medicine at Baylor College of Medicine, says that includes diseases like E. coli, typhoid fever, salmonella, or even worse.
There is a possibility of cholera erupting on the island of Puerto Rico.
It's happened before on the island, and this devastation on the ground raises the likelihood it may happen again. So Hotez says it's critical the U.S. response is swift and focused.
And it also depends on our national response to this. You know, bringing in the U.S. Army and the National Guard is going to start putting in the elements of an infrastructure in place to mitigate that likelihood.
Hotez says it's too early to consider using cholera vaccines, but he believes health officials in Puerto Rico should consider vaccinating for hepatitis A and typhoid fever now.
Well, the relief is absolutely critical, and it's not just diarrheal disease. It's additional medical interventions and additional interventions overall.
Hotez says the island needs additional support and supplies from the CDC, but most of the heavy lifting to prevent disease will fall on the shoulders of local health departments in Puerto Rico. Problem, many of those same health departments were destroyed by Hurricane Maria. Standing for Houston, Marcelino Benito, KHOU 11 News.